Hi, everyone. My name is Dr. Bhavik Sheth. I'm a physical therapist, and I mainly work with orthopedic and sports physical therapy. However, today's topic is going to be a little bit bigger, but this is a topic that will be very, I think, interesting to all of you. Today's topic is going to be about the medical benefits of strength training. So, a lot of times when people think of exercise and getting stronger, making your muscles more fit, people think that the main benefit of that is your muscles get bigger, you look better, your posture improves, and you get a little stronger. That's what people think are the main benefits of strength training, right? Strength training is when you use resistance. You can use your body weight, you can use dumbbells, you can use resistance bands, you can use machines. All of that is a form of strength training. But the really interesting thing, based off of like hundreds of articles and research done by the top institutions in the world, like from Harvard, from like the biggest like hospitals in the world, they've done a lot of research on the medical benefits of strength training. And that's what I'm going to teach you today. Um, and then by the end of today's like webinar, I'm going to show you what strength training really looks like and how it should feel. Okay. So before we talk about anything, I'm going to ask the group a few questions. So just raise your hand if the answer is yes. Okay. Um, how many people here know someone that has suffered from depression? Raise your hand. Like they've been diagnosed with depression. I know a few people who have. Just raise your hand if you know somebody who has depression or anxiety disorder. So there's a few people. I see some hands. I'm like going through the pictures. Good. How about I think this is going to be much more common. How many people here know somebody that has diabetes that has been diagnosed with diabetes? Right. This is much more common. Yeah. How about heart disease? Like hypertension, high blood pressure, who has high cholesterol, and there who knows somebody that has high cholesterol? Raise your hand. So very common also, right? What about dementia? Does anybody have a family member or like somebody that they know that has had dementia or Alzheimer's disease or any kind of cognitive impairment? Raise your hand. So I know some people. These are people in my family and my friend circle as well. Um, what about kidney disease? How many people here know somebody that has kidney disease, needs to go to dialysis, is taking medication for like diuretics, which means that the water pills. Sometimes they say you take a pill to remove the water from your body. How many people know somebody with that? I do. All right. And how many people here know somebody that has fallen um, in the last 3, 4, 5 months? All right. So these are all very important, very life changing medical conditions. Okay. But the common thing between all of these things is that strength training has been shown to have really, really strong positive benefits for all of these medical conditions. And I'm going to explain to you what all of that really is. So before we start anything, like as you can see, a lot of people that we know or us ourselves might have some of these conditions. And by strength training, you can actually improve the symptoms. You can also improve the disease process by getting stronger and exercising to get stronger. And I think this is like a really powerful thing. Okay. So first, I want to talk to you about depression. Okay. Um, so depression is a very common mental health condition that has shown that people with depression, the chemistry in their brain, like the hormones and the neurotransmitters that are part of what makes people happy and makes people excited, makes people energized, the chemistry of that is a little bit different in people who have depression, right? So with strength training, there was a study done by Harvard. They looked at almost 2,000 people, and what they did was they saw that they compared people who did strength exercises twice a week, and then people who did not do any kind of strength exercises, and they saw that people with mild to moderate depression who exercised twice a week had a significantly reduced symptoms of depression. It also improved their ability to sleep, and it also reduced their perception of pain. So a lot of times when people have depression or other mental conditions, mental health conditions, um, they might also be a little bit more sensitive to pain, or might be a little bit more sensitive to disturbances that makes it hard for them to sleep. They might be more anxious. They might have more anxiety. But by strength training, what they saw was that the brain was actually releasing more hormones to make these things better. So hormones like norepinephrine, dopamine, serotonin, a lot of these hormones are really what makes us feel happy. They're hormones that make us feel excited, energized. And strength training increased how much of these hormones were getting released by the brain. So if you know somebody who has depression, it's very important to make sure that they are seeing a therapist to talk about their lives and talk about their condition. And then also, if they combine that with strength training, they can get really, really good and powerful benefits of that. Okay, so that's just number one. A lot of times, mental health in our culture, American culture, Asian culture, does not really get talked about. It's seen as something that you keep in your family. If you're depressed, you stay home. You don't talk to anybody about it. I completely disagree with that notion, and I think it's very important to talk about our feelings. It's very important to talk about what's on our mind. If we're scared about something, I think it's very important to talk about these fears. Like we're talking about a lot of fears right now with coronavirus. It's important to talk about this, and then it's also important to strength train so that your body's also like getting into a better place. Okay. Um, and then let's continue talking about the brain. All right. So dementia is, again, a very common thing that people experience as they get older. But what happens before dementia actually gets diagnosed or Alzheimer's disease gets diagnosed, is like something that's a little bit more mild. It's called MCI. It stands for mild cognitive impairments. And this is basically like imagine dementia is the end product. Mild cognitive impairments is step one, and it slowly progresses to dementia. So this is something that does happen with a lot of people. I work with a lot of people right now that have these mild cognitive impairments. Um, but the really important thing with this is strength training has shown to protect people from getting mild cognitive impairments, which means that people that strength train are less likely to develop mild cognitive impairments, right? And then also, if they have mild cognitive impairments already, if they strength train, the like how quickly it develops into dementia, it slows down by strength training. And what they did in another study was they, again, extra strength training twice a week. They saw that people's brain function, how they were thinking, how they were processing information, how they were learning things, by strength training, all of that improved. Okay. And they also later on, they did another follow-up study. The brain, they looked at parts of the brain that is really linked to dementia and Alzheimer's disease. And they found that in groups of people that strength trained, the gray matter, which is where a lot of the neurons are, the gray matter is it's basically like the processing part of your brain. Okay. That gray matter was actually thicker and more dense in people who strength trained, and people who did not strength train, that gray matter was actually getting smaller and smaller and smaller as people were getting older. So the really awesome thing with this is by strength training, not only are your muscles getting bigger, not only are your muscles getting bigger, your brain's also staying big too. And I think that's really awesome. All right. So those are like the two main things related to your brain. You can be happier, you can be less anxious, you can have better sleep, and you can be smarter, right? You can be smarter, you can have more cognitive ability if you're strength training. And this is all proven. This is not my words. This is the words from like Harvard researchers, other researchers all over the world. And this is the kind of information that I think is very important to see and learn about. So those are like the two main things I think are the most unexpected benefits of strength training. You can be happier and you can be smarter if you strength train. And then from there, let's talk about other medical benefits. Okay, so other like really common diseases that a lot of people have. Okay, so diabetes is number one thing. I try to talk about this with every person I meet. Diabetes is one of like the worst medical conditions that somebody can get diagnosed with because it can affect your whole body. It can affect your toes, it can affect your nerves, it can affect your eyesight, it can affect your brain, it can affect everything. It can affect your kidneys, it can affect your skin, your heart. So diabetes is one of the worst things that somebody can get diagnosed with, and it's very important to people for people to control and manage before it gets really bad. Okay. And type 2 diabetes specifically. Type 2 diabetes is when the body's insulin does not work as well as it should. So your body's producing insulin, but it's not really working as well as it could. What happens is that your body becomes resistant to this insulin. Okay. By strength training, what they actually saw was that your insulin becomes more sensitive and it works better even if you have diabetes. So what diabetes is, it's like an elevated amount of blood sugar in your blood of sugar in your bloodstream. So when you have a lot of sugar in your bloodstream, there's a lot of bad things that can happen. But the main thing is that your body is going to store all of the sugar as fat. And the more fat you have in your body like that, the less sensitive or the less strong your insulin will be at working against reducing the sugar from your bloodstream. By strength training, you're actually making your insulin work better. You're making your insulin, the power that insulin has in your body, it works better when you strength train, so that it lowered your blood sugar for a lot of people, and less of this blood sugar gets stored as fat. And I think this is the important thing with diabetes, is that this is a lifestyle condition. We have to really change your diet. You have to change your activity levels. You have to change so many things, because it can affect a lot of these parts of your body. But by incorporating strength training, you're actually making your medicines work better. Your blood levels of your sugar are actually coming down, and that's the number one predictor, and that's like number one decision maker too, if you need medication or not. If you have blood sugar that's like 200, 300, all like really high, unmanaged, uncontrolled, and you need to take so many medications to control that, strength training is going to make these medicines work even better. All right. And hopefully it can get to the point where if you're borderline and your blood sugar is a little bit high, your A1C is a little bit high, if you start strength training now, it's going to make your insulin work even better. So then your numbers can start coming down into a more healthy range. All right. So diabetes, again, it's a very bad thing. If you have it, please manage it. Talk to your doctors. And in addition to everything your doctor is recommending, you should also be doing strength training. And that's gonna make your whole life, medically speaking, better, and also to make you happier too. Um, I know I'm talking really fast, but this is because I'm really excited and passionate about this topic. Okay. Um, I'll have a lot of time at the end to answer questions. So the next thing that strength training really helps with is heart disease. We spent a lot of time last session talking about heart disease, and we talked about what it is and how can you manage it to improve it, right? So today I'm gonna also like talk to you about what is one of the main things that can help heart disease, and that's strength training. Okay. There was this really interesting article that was done that compared aerobic exercise, and this is what I talked a lot about last week. When you have heart disease, when you have cholesterol, when you have like a weaker heart or high blood pressure, one of the main recommendations is to do more walking. Walk more, work on a treadmill, do some bicycle exercises, do some swimming, more cardio exercises for your heart. But what a study found was really interesting, that strength training, getting stronger and working with weights is actually shown to be more protective for your heart than walking is, than other kinds of aerobic exercise. So this is like, one of those very surprising things that aerobic and cardio exercise, it sounds like cardio exercise is good for your heart, but strength training is better for your heart than cardio exercise is. And I think that's just awesome. And what they looked at was minimum of 1 hour per week. You should be doing exercises using weights, minimum of 1 hour. And what they saw was that it reduced the risk of developing high blood pressure, reduces the risk of developing high cholesterol, and also reduces the risk of having high or elevated blood sugar. And by strength training at least 1 hour a week, and that could be 1 hour one day a week, it could be 30 minutes twice a week, but by exercising for 1 hour a week, those three things, high blood pressure, high cholesterol, and blood sugar, the risk of developing those three things dropped by 70%, 70%, by strength training 1 hour a week. Okay, just to show you how big these research, the research behind this is really like big numbers, really like big studies with thousands and thousands of people, and the results are so surprisingly positive that strength training has shown to reduce the risk of getting all of these things by 70%. And for most things in medicine, if it's around 50%, that's really good. 50% is really good. 55% is really good. 60% is really good. So if something can reduce the risk by 70% and it's as simple as exercise, no medication needed, no fancy equipment needed, no expensive equipment needed, just exercising to get stronger, something that simple had that powerful of a benefit. This is like one of those few times in medicine where everybody has access to this. It doesn't matter how rich you are, what insurance you have, where you live. It does not matter how much money you have or how much time you have. 1 hour a week can make you 70% healthier if you have these cardio risk factors. Okay, and I think that's awesome. A lot of times people struggle with like medication like insulin. It's so expensive. Other medications are really expensive. If you exercise, it's free. It's free. All it takes is a little bit of work, but the benefits are so powerful. All right. So we're not done. There's still two more really awesome benefits of strength training. Kidney disease. So over the age of 65, around 40% of people have some kind of kidney disease. Okay. And that could be some kind of renal failure. It could be, like your the electrolytes in your body are imbalanced. It could be a buildup of fluid in your body. All of these things are kidney disease. And around 40% of people. So right now in this group, we have 50 people. That means 20 out of 50 of these people might have some kind of kidney disease. So it's that popular of a condition. What they saw was by strength training 3 times a week, it helped to reduce the main symptoms of kidney disease, such as itching, shortness of breath, impotence, and muscle spasms. Those are the main things that happen when you have kidney disease. They're very common symptoms if you have kidney disease. And by strength training 3 times a week, that all of these symptoms were reduced. Okay. And one more important thing to know about kidney disease, one of the main side effects, or one of the main physical things that happen when you have kidney disease, is your muscles start wasting away. Your muscles get smaller and smaller and smaller if you have kidney disease. And that's very common. And by strength training, you can actually slow down that wasting of your muscles, and you can actually build it back up. So strength training, not only does it improve the symptoms of kidney disease, but it can also help reverse one of the main side effects of kidney disease, which is muscle wasting. Like instead of making your muscles get weaker and weaker and weaker, strength training can make your muscles get stronger and stronger and stronger, and make you feel more comfortable because there's be less itching, less shortness of breath, less like muscle spasms, all of that things. Okay. And for the main final thing, strength training can actually save lives. Okay, it can save lives. It can prevent deaths, and I'll explain to you how. Um, Interestingly enough, one of the main causes of death for people that are over the age of 65, in addition to cancer and heart disease, is falling. Falls are one of the leading causes of death in people over the age of 65. And what does that mean? Like this is something I see a lot just through work, but then also in family as well, where if you fall and you unfortunately might break a hip, might break a rib or some body part, and then you end up going to the hospital, and then you end up being in bed for like 1, 2, 3, 4, 5 weeks. That after your bone might heal, but then you can't stand anymore. You can't walk anymore. You can't go to the bathroom, but you can't walk yourself to the bathroom anymore. These are things that happen to a lot of people. And the main thing that causes all of these things is a fall. So by strength training and getting your muscles in your legs stronger, you can reduce the risk of falling by over 33%. Meaning if somebody's going to have one fall or two falls or three falls, by strength training, they can reduce that number by 33%. So there's a less likelihood of you having these really bad events because you're less likely to fall in the first place. And if falls are one of the main causes of death in people that are over the age of 65, by strength training, you can basically prevent one of the main things that causes people to get, from people to die by strength training. So strength training can save lives by stopping people from falling. It can save lives by improving people's hearts. It can save lives by improving people's brains, so you can learn better. You can actually think a little bit better, and you'll be happier, right? You can be happier by strength training. And you'll also look and feel better. You'll stand with better posture. Your muscles will be bigger. You'll have more energy. There's so many of these awesome, really cool things that happen from strength training. So just to quickly summarize, what are the main medical benefits of strength training? Number one, it can help reduce dementia, the risk of getting dementia or cognitive impairments. It can reduce the risk of getting depression or anxiety disorders. So you can feel happier and be smarter. If you have diabetes, it can lower your blood sugar, and it can improve how sensitive and how your insulin works. It can make that work better. If you have heart disease, it can lower your risk of getting high blood pressure, high cholesterol, and lower your risk of getting elevated blood sugar levels. If you have kidney disease, it can improve all of your symptoms of kidney disease, and it can also help prevent one of the main side effects of kidney disease, which is muscle wasting. And it can save your life by making sure you don't fall. So these are all the really powerful, powerful, powerful benefits of strength training. Okay. Now, the main question is, a lot of times people have
voice કેમ નથી આવતો?
A lot of times people have these not misconceptions, they have like these concerns about strength training. They think that they're going to hurt their knee, they're going to hurt their back, they're going to hurt their arms if they strength train. That's why it's very important for you to talk to a physical therapist, to see a physical therapist, so they can look at your whole body and tell you which exercises are safe and good for you to do. Okay. If you have knee pain, that does not mean that you should not strength train. You should 100% strength train, because it's going to make your whole body that much better, not just your knee. It'll make your knee better, but it'll also make your brain better. It'll also make your heart better, and it'll also make your kidney better. And you'll sleep better, and you'll be happier. So all of these are really good things that happen. Okay. So strength training is not a bad thing, and it's not something to be scared of. All right. So what does strength training look like? I'm going to show some of you guys this. So if anybody here has any weights or bands, like if you have any kind of dumbbells, if you have any of these, like these bands, try to go find them in the next 1 minute. I'll wait. And then I'm going to show you guys what an actual strength training routine looks like. Okay, it's going to be a little different than what I think a lot of people are used to doing. All right, so let's take 1 minute, find your equipment. I'm just going to bring some of my stuff here too so I can show you guys what strength training is. So if you have bands like this, get them. If you have bands like this, get these. If you have any kind of dumbbells, get them too. We're going to be using some of this for what strength training really should look like and how it should feel. All right. Yeah, let's wait another 30 seconds and then I'll show you guys a few things. If you guys have any questions right now, you can type it in. I'll answer them at the end, or you can just get ready for the next question and answer portion. All right. Give me a thumbs up if you guys are ready. Thumbs up. All right. I see a couple thumbs up. Good. All right. So before we start about strength training, I want to explain to you how hard you need to work when you're strength training. Okay. A lot of times people ask me, how many times should I do an exercise? Should I do it 10 times? Should I do it 20 times? Should I do it 30 times? The short answer is, to get muscles stronger, you need to do an exercise around 10 to 12 times at least for multiple rounds, okay? That means, like, if I'm exercising my arms, like I have these 5-pound weights, okay? If I'm doing this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, right? I did 12 with 5 pounds. Does that mean I'm going to get stronger because I did it 10 times or 12 times? No, that does not mean I'm going to get stronger because I can do so many more. I can do probably another 30 of these, okay? So me doing this exercise 10 times with 5 pounds is not going to get me stronger, all right? But then I said that, you have to do an exercise 10 to 12 times to get stronger. What that means is when you do an exercise, it needs to be really hard to do it 10 to 12 times. If you can do it for 10 to 12 times and you can't do any more, like if I do an exercise 10 times, but doing it the 11th time is so hard to do that I need to take a break, then I'll get stronger. So now let me show you what that same exercise looks like if I'm using 20-pound weights. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I can do a few more. I can do probably another 5 or 6 more. So I did 14. And now compare that level of effort to me doing this 14 times. This is so easy. So just by doing an exercise 10 times does not mean you're going to get stronger. The effort needs to be really strong, right? So if 5 pounds are really easy for you to do, then it's not going to make you stronger. You need to do an exercise 10 to 12 times, but it needs to be hard. It needs to be challenging. You need to get tired. Your arms need to get tired. Your breathing needs to happen faster. And then you'll get stronger. So I just did the exercise 14 times with the 20-pound weights. I could have done more. So what's a safe amount of weight to do? The answer is as heavy as you can do safely for 10 times is the weight that you should be doing. What I mean by that, I'm going to show you the same exercise using 30-pound weights. And you guys will see the difference, okay? You guys will see me cheating a little bit. You guys will see me doing things a little bit wrong. And then you'll see that why this is not the right way to exercise, okay? All right. So the same exercise, I'm going to try to do with 30-pound weights, all right? I'm going to try to do 10 to 12. 1, 2, 3. Do you guys see what's happening to my back? 4, 5. So I did 6 right now. And when I was going up, I started cheating a little bit. My back started to go backwards. I started to lift from my back rather than my arm. So for me, the 30 pounds are too heavy for me to do properly. So that's too heavy for me to use when I'm strength training. I need to do things a little bit lighter. So for me, even though I was doing the 20 pounds for 14 times, I should stick to that amount of weight because I wasn't cheating. I wasn't doing things a bad way. All right. So like my point in this is to show you that when you're strength training, it needs to be hard. If you only have 3-pound weights at home, but you're doing these exercises with 3-pound weights, you're not going to get stronger. You need to get heavier weights. So what are some things that you can do to make things heavier? Number 1, find something heavier. So if you have something at home, like a bag, and you can lift a bag or a gallon of milk. A gallon of milk is around 8 pounds. So those are the things that you should be doing to get stronger. All right. So me just doing one exercise 10 times is also not going to get me stronger. I need to do that same exercise 3 or 4 times. So I just did it 14 times. I have to do it again. And you can see I'm not going to cheat for my back. It's going to be just for my arms. So this is 7, and I'm already getting tired. 9 and 10. And did you guys see how hard it was for me to lift it up the last time? I was shaking and I was doing it really slowly because I just wasn't strong enough. But that's how hard exercises need to feel to get stronger. So if you're doing exercises, even like I know a lot of people do exercises like this with your arms. If you're doing this like 10 to 20 times, but you have no problems and you can do more and more and more, your muscles are not going to get stronger in your shoulders. You need to do it with heavier weights or a different type of weight so it's harder to do. Okay? Exercises like squatting is one of the best exercises you could do. So if you have a chair, let me show you. I'm gonna bring this chair down. So some of you can see through the mirror in the back. So I'm gonna show you an exercise that I love doing for my legs to get stronger. Somebody is sharing a screen. Okay. All right. So one really good exercise to get your legs stronger is to squat. So what does squatting mean? It means you're sitting up and down. 2, 3. So this is great for my thighs, great for my hips. So this is my 10th one. If I did 10 of these, and do you see how I'm not really struggling? I'm not slowing down. It's not hard for me. Me doing a lot of squats like this, it won't get me strong. I need to do it with weights to get strong. So what I'm going to do is take this weight. I'm just going to hold it here. And I'm going to do the same exercise. So I just did 10 of them. It wasn't that hard for me. I could have done so many more. Like when I was doing the exercise with my arms, the last one was really hard for me to do and I couldn't do more than 10. I could have very easily done another 20 of these and I wouldn't have been tired. What means is if I'm trying to get stronger, this one 20-pound weight was not enough for me. I need to do it heavier. I need to do it with more weight. So then that same exercise, if I do with these weights, with these 230, so this is 60 pounds right now. If I do the same exercise with 5, 6, 7, 8, 9, 10. So again, I did it 10 times with 60 pounds, okay? Because I did it with 10 times with 60 pounds and I could have done more, that means that that weight wasn't enough for me, or it means I wasn't going down enough. So for me to get stronger, I need to do that exercise differently. Whew, I'm a little tired. But my point for you is strength training does have a lot of positive benefits, but you need to make sure you guys are strength training safely and smartly, and also using as much weight as you can do safely. None of these exercises hurt my arms. None of these exercises hurt my hip and my knee, because I evaluate myself. I have people look at me. I have people checking to make sure that I can do these exercises properly. I have a history of knee and back issues. I've had 3 knee surgeries. I've had a pinched nerve in my neck where I couldn't even sleep for like a week. I have lower back issues. But whenever I strength train, I actually feel better. My knees feel better, my neck feels better, and my lower back feels better. Because it's not because I'm smart, it's not because I'm strong, it's because I got my body checked out. Because I went to the doctors, I had x-rays and MRIs done. I've been going to therapy for my knee for a long time. I've had my friends who are PTs look at my neck and my back and they kind of tell me like, hey, like your pelvis is like this, your back is a little bit like this. So they're teaching me about my body. And then I'm exercising to fix these things. And by me fixing these things, I'm getting happier, right? I feel happier. I feel more energized. I sleep great. So far I'm young, so I don't have that many heart issues, but my blood pressure is good. My blood sugar is good. My cholesterol is really good. I haven't fallen. So all of these things, all of these benefits are still possible for you. And the important thing is, don't be scared of strength training. Strength training is really, really, really good for your whole body, but not just physically. It's really good for your brain, good for your blood systems, good for your heart, good for your kidneys, good for so many medical reasons. It's also good for your mood, makes you happier. So you should be strength training, but if you need guidance, if you need advice on how you can do it safely and appropriately and with enough effort, like I'm still tired. I'm still breathing hard from those 3-4 exercises. That means that's how hard you need to work also. And if you're not sure how to do it, then please talk to a physical therapist. This is our expertise. This is what we are trained in. I spent like 7 years learning this stuff just to get my degree. And then I spent 4 or 5 years teaching myself and also like working with over like 10,000 different visits. And again, this is nothing about me being like a great physical therapist. This is almost every physical therapist will be trained in this kind of thing. So if you need to see somebody, start with the physical therapist and they can teach you how to safely do things for your arms and your legs, just so your heart can get better, your brain can be smarter, your kidneys can function better. All right. So again, if you need any kind of advice, please talk to a physical therapist. They're the best people that can look at your whole body and then teach you what are the best exercises that you should be doing. So if anybody has any questions, please either type them in or raise your hand and we can answer those questions.
Yes, I see Butala uncle has a question. Butala uncle, go ahead. And there are some question in the chat also. Butala uncle, unmute yourself.
Okay, I want to know which exercise good for heart patient.
Yeah. So which exercises are good? The general answer is strength training is really good for heart patients. But strength training could mean 100 different things. So arm exercises are strength training. The squatting that I showed you is strength training. These are all types of strength training. But what you need to do is talk to a physical therapist and they can look at your whole body and tell you which are the best exercises for your heart and your body. Okay? But
Okay.
strength training is what you should be doing.
Okay.
And the second question is, what is the depression and emotional? What is the different two things?
I'm not sure. I don't have the most experience with with mental health conditions, but depression is a combination of like 4 to 5 symptoms. And there's what's called like there's like a group of symptoms, and if you have 4 or 5 of them, then it would be diagnosed as clinical depression. So I don't know exactly the difference between depression and emotional thing that you're talking about, but there are doctors that can diagnose you if that's what you have, and if
Maybe
that's
it's
what
a
you
mind weakness or strong
No.
mind?
no
Nothing?
no. Okay, again, this is the idea that we need to change. Depression is not weakness. Depression is not weakness. It's not. Depression, there are the chemistry in your brain. Like when people have high cholesterol, they look at your blood, right? And when people
Yes.
have high cholesterol, that means they have more cholesterol, or if somebody has like low blood sugar, that means their blood sugar is low. It's the same thing for depression. There's certain things that are like too much in your brain, certain things are too little. So this is chemistry. Okay. So depression has nothing to do with strength, it has nothing to do with weakness. That's not what depression is. Depression is a medical, clinical condition.
Mhm.
Yeah.
Dr. Bhavik, there are some questions
Yeah.
here in the chat.
I see
One
them.
of them is 30-minute, 5 days a week bike, is that good exercise?
Okay, so that's a great question from Bharti Parekh. Biking 30 minutes for 5 days a week is good, but that's not strength training. So that will work on your cardiovascular system. That's going to work on your aerobic exercise, which is good to get your blood flowing. But the benefits that we were talking about today for your depression, for dementia, for your brain, for kidney disease, for heart disease, for preventing falls, biking 5 times a week will not improve that. You need to strength train, and strength training is very different than bicycling for 5 times a week. Bicycling 5 times a week is really good for you, but it's not strength training, and strength training is generally better than bicycling. So there's another question from
Yes, from Kishan
Kishan.
uncle. Yeah, that it does yoga and walking also help in strengthening the muscle, or we should do weightlifting?
Great question. Yoga and walking are not strength training. They will not make your muscles stronger like lifting weights and weightlifting will. Weightlifting, using weights, using bands, using machines, that's a different type of exercise, and you should do that with yoga. You should do weightlifting with walking, and both of those together is really good. But walking and yoga can never replace strength training. It's not going to replace that. But interestingly enough, if you strength train, your flexibility can improve, your walking can improve, and then everything we talked about today, your depression, your heart disease, your kidney disease, your diabetes, all of that will improve if you strength train. So if I had to pick 2 things, yoga and walking or strength training is the superior form of exercise, as long as you can do it without hurting your body.
Okay.
Yeah.
Bharti aunty has raised her.
Yes.
Unmute yourself, Bharti aunty.
Okay, if we do the dumbbells 5 pound,
Mhm.
like a 20 times, 25 times, is it okay?
If you can do dumbbells 20 to 25 times without taking a break, is that what you're saying? Without taking a break?
Yes, without taking breaks.
That means it's too light to make you stronger. It's too light. So what you can do is if you have 2 dumbbells, hold them in the same hand and do 1 arm at a time.
Okay,
Right?
I can do
So
that. But
yeah.
I have
So if you have 5 pounds, I can also hold them in the same arm and do it.
Okay.
Okay. So that if you can do any exercise 20 to 25 times without needing to take a break, that means it's too light for strength training. It's good for everything else. It's good for your blood, it's good for your aerobic, it's good for your heart, but it's not strength training. So it's not as good as it could be if you did it heavier.
Okay. Then there is a question here from Pramodini Auntie. Should you work on one part of the body at a time, or all parts of the body?
That's a great question. So a lot of times when people go to the gym, what they do is they work on different groups of exercise. So what they do is if you're going to the gym 3 to 4 times a week, you can spend two times working on, you can spend half of the time working on one body part and the other half working on a different body part. So it really depends on how much time can you commit to exercising. If you're only going to the gym twice a week to use machines and use weights, then I wouldn't necessarily break it up into different body parts. I would do exercises that work your arms and your legs together. I would combine exercises so you use the most amount of muscles with each movement. So even me doing this one exercise, this is one exercise and it's only working one body part. If I had different equipment here, then I could do different exercises that works on my arms and my shoulders and my back at the same time. So then that's the way I would do it. So the more body parts you use for an exercise, that's typically better. But sometimes people have pain using big motions or using heavier weights. So they need to do things a little bit slower first, a little bit more simple, get stronger, and then do the more complicated exercises later.
Okay.
I have one more question.
Yeah.
Hello.
Yes, go ahead, Bharti Auntie. And
Okay, I have a bike with the hand pulling exercise. So is it better? Yes. Yes,
Yeah.
like that. Yeah.
Those are awesome. I love that. They're usually they're called assault bikes, right? ASSAULT, assault bikes. Those are one of the best exercises for cardio.
Okay.
Because it's getting your arms and your legs working at the same time. That is really good for your body and your heart rate to go up. So that's an awesome, like that type of bicycle is better than a bicycle without the arms.
No, I have it with the arm.
With the arms is better,
Yeah.
but it still won't replace strength training.
Oh, okay. Okay.
Yeah.
I got it. Thank you.
I
Thank
see
you so much.
Harjeet Auntie has a question. Auntie, you have to unmute yourself to ask your question. Yeah,
Are you listening me? Are
Yes.
you listening?
Yes.
Okay. I want to ask if you're doing 1 hour exercise in the pool.
Did you hear what she asked?
No.
Oh, she said if you're doing a walking and hand exercise in the pool.
Yeah.
If that's
Is it good enough?
No, it's not good enough. Walking and other exercises in a pool are good for your heart and good for your blood to like start circulating a little bit better, but it won't replace strength training. So using weights, doing things on land versus water is different. It's different. So doing exercise in the pool is really good to do, but alone that won't help you with falls, right? Like if you're in the water, that's not going to improve your balance. That's not going to make your bones stronger. That's not the same type of exercise as strength training. So strength training is really good. Water exercises are really good, but they're different. They're different. So the benefits of one are not going to be the benefits of the other.
So you have to do on the ground, whatever you are doing.
Yeah.
Thank you so much.
You're welcome.
Thank you.
I have time for like 2 more questions.
Anyone else? Oh yeah, Rasila aunty, go ahead, unmute yourself. Unmute yourself, Rasila aunty. Rasila aunty, we cannot hear you. Yes, now.
Okay.
Yes.
Yeah. Hi, doctor. I bought a bicycle. It scan, time, speed, burn the calorie, and this is the for hand right for the hand. It is very good for the this winter.
Yeah, so a lot of these exercises, again, in the winter time, because we can't go outside, having a bicycle, having a treadmill, exercises like that are good to do at home.
Right.
But there's a lot of strength training that you can do at home. And there's a lot of exercises, even if you don't have dumbbells, even if you don't have bands, you can still do strength training at home without any equipment. So there's this whole type of exercise called calisthenics. So that's just a type of exercise that's strength training, but you're using your body as a weight. And your body is, because I weigh 140 pounds, I can do exercises with my body weight and make my muscles stronger. But that type of exercise is different than using dumbbells and using bands. But strength training, you can still do it without any equipment. You can still do it at home. You don't have to go to the gym to do strength training. You can also do strength training at home, and you'll get the same benefits.
Right. Okay. Thank you.
Dr. Bhavik, I have a message from Nalin Ved. He says, do weights every day, 16 pounds and 20 pounds, along with Surya Namaskar and yoga, pranayam, walking, and walking 7 days a week. So total about 1.5 hours. I'm 70, don't take any medicine for my memory. I memorize whole Gita. It took me 12 years and I love it as it's totally positive outlook.
Good. I think Nalin Ved, I think this is amazing. And I think this is something that everybody should try to do. And this is something that I need to try to do. I don't do weights every day. I don't walk every day. I don't do the Surya Namaskar. I think that's a great routine. If you're 70 years old and you were able to memorize the whole Gita, that's amazing. And maybe all the exercises you were doing made your brain more powerful. It helped you learn a little bit more, because that is one of the benefits of strength training. So whatever you're doing, this is amazing, and I really encourage you to continue. This is something that I also need to work on, and I know a lot of people need to work on. So that's a great message.
Okay.
All right. Again, let me just summarize this whole webinar. If you have any more questions, you can call me, you can email me. But strength training, it needs to be challenging, it needs to be difficult, and it needs to be hard. If it's hard, then your muscles will get stronger. If it's easy, then your muscles won't get stronger. And if your muscles get stronger, you're going to be happier, you're going to sleep better, you're going to be smarter, your kidneys are going to be better, your heart is going to be stronger, your insulin and your diabetes is going to be better. You're going to have less diabetes. You're going to live longer because hopefully you won't fall. So there's so many really powerful medical benefits.
And cholesterol too.
Your cholesterol is going to go down. Your high blood pressure is going to go down. Your high sugar is going to go down. You're going to get smarter. You're going to be happier. You're going to sleep better. You're going to have more confidence. So there's so many really good physical and medical and psychological benefits of strength training. And I really encourage everyone to learn and do some more strength training, at least for minimum of 1 hour a week. Okay, minimum of 1 hour a week is something that we should try to do. All right. As always, it was great. It was great doing this. And if you want to get in touch with me, let me screen share if I can screen share my contact page where I have my phone number and my email address.
One sec, let me let you, because remember earlier someone was trying to screen share,
Yeah.
so I took that ability out. So now you'll be able to go ahead.
All right. Let me find that. So this is like my contact page. Please feel free to contact me. This is something that I'm very passionate in doing. This is something that I think that our whole community can benefit from. And I want more people to have information and access to this. So call me, email me if you have any questions. Yeah. As always, it was nice talking to you guys, and talk to you soon.
Thank you, Dr. Bhavik. Always very informative.
Thank you.
Thank you. Thank you.
Thank you, Dr. Bhavik.
Thank you.
Thank you.
Thanks a lot.
Thank you. Thank you.
Thank you very much.
Excellent.
Thank you very much.
Thank you, Dr. Bhatt.
Nicely explaining you.